Okay, so we are going to continue on with the Systems of Control unit in Essential Science. And as a preliminary to this, I want to direct you to chapters 5 and 6, specifically in your Fundamentals of Therapeutic Massage textbook. Research, literacy, and indications and contraindications. You will find a lot of this language used in those chapters as we're trying to figure out just how does massage provide benefit and how we have to be cautious so that we don't harm anybody. So let's get right into the next chapter, which is the peripheral nervous system. Just like the other chapter and every chapter in Essential Science, you've got a lot of YouTube videos to look at here that expand, as well as your online course that goes with this. This has a little less concreteness to it. There are actual nerves and reflexes, but you can't as easily trace the autonomic nervous system as well as you can trace the peripheral nervous or the somatic nervous system. Both part of the peripheral nervous system here. So I can draw a line along my arm that might be on top of a somatic nerve. It's a little harder for me to put my hand on a nerve that is controlling digestion. And we're also going to delve into the basic senses that go here, and then the pathology. So, should be old hat now. Read your objectives, know your key terms, learn how to learn this information, get your general idea of what your reading section is going to be and what we're talking about there by looking at the section objectives. I'm going to have a little bit of overlap between the previous chapter, but this is more about the nervous system structures outside of the central nervous system. So nerves are collections of neurons, and we have sensory that listen, pay attention, and deliver information, and motor, which provide the response. And lots of times you'll find these mixed together and wrapped up in a connective tissue-ish type covering, and that's a mixed nerve. So comes out of the spinal column, comes together, transmits information back and forth. And so this is an information pathway. The nerves are covered with connective tissue. And again, this is an area that sometimes you'll get a question on the MBLEX. So this is a language thing. Then there's the cranial nerves. And there's some fun little learning tips on the YouTube videos about remembering cranial nerves. The one we actually spend the most interface with in terms of benefit is the vagus nerve. A lot of study on that. Tiffany Field is a researcher that has looked at that maybe a mechanism of massage interface that causes benefit has to do with some sort of stimulation or to this vagus nerve function. Sweet picture. So here are all your cranial nerves. They're described down through here. And then nerves come together. So they come out of the spinal column, the vertebrae, through their own little hole, but then they collect together to distribute the sensory and motor nerves out into the body. And there's some overlap there. So these are those plexuses that I mentioned in the previous video. So we have cervical, brachial, lumbar, and sacral. And these areas are also vulnerable to changes in the structure, which changes the hole or opening or tunnel that they come through, these nerves come through, and soft tissue can be a part of that as well, okay? So we can maybe, if there is some sort of entrapment at the lumbar plexus, for example, that's causing discomfort in the lower leg or into the low back, maybe we can shift the tone of the muscles and the density of the connective tissues a little bit, which will allow maybe a change in how the pelvis itself is sitting, which might create a better opening for that nerve to come out. So there's a potential here for some direct influence, sort of direct. These various areas, especially as we age, are more prone because we have postural changes, shifts from muscle structure to fat, changes in the connective tissue support network. And these can be very difficult to treat as well. And symptomology, pain symptomology, neurologically based pain related to these, very difficult to treat. And so part of the opiate crisis that we've had does come from trying to give people some relief if these areas are shooting signaling. And massage is helpful generally. Don't press on the nerve that's griping. Don't, you find the area where you've got the symptomology, but then you try to create space as you're treating this. These are all your spinal nerves. It's a good picture of this. And then here are specific pictures related to the plexuses. So do have a working knowledge of the names of the nerves in through here. And then here's our brachial plexus. This is the one that tends to radiate into the shoulder behind the scapula and down the arm. Cervical plexus, top of the shoulder, into the neck, up into the head, over into the jaw a little bit. Lumbosacral plexus combined here. And then you review what you have learned. And then these are the dermatomes. So if somebody comes to us and says, I am experiencing numbness, tingling, discomfort, whatever they want to call it, and they swipe along this area of blue, we can maybe make an assumption that something is going on up here in the cervical area. And then the distribution through the trunk, notice that there's some of this that goes down into the arm. So these dermatonal representations can give us a little bit of an idea of where up in the trunk area where there might be some compression or irritation or inflammation. Now, a lot of what happens with the somatic or the peripheral nervous system is based on reflexes. And this is just efficient. It's efficient to have a lot of sensory and motor activity processed through the spinal cord and lower brain areas into the brain stem. And a reflex is something that just is kind of pre-programmed. It automatically happens. Now these can be learned too. And that then can lead to either some sort of precise performance that happens with a training effect, like even learning how to type, how to keyboard, once you don't think about it anymore. But the ones we're going to talk about here are ones you're sort of born with. And we actually can kind of stimulate with massage a little bit the application of a mechanical force. We can kind of get these reflexes to fire a little bit, which can be kind of a reset button. So then we get into our listening stations. These are our actual parts of the nervous system that are picking up information from the outside world as well as what's going on. And each of them's picking up a particular type of information. And that's described in through here, like the mechanoreceptors. In general, they're looking at changes in pressure and movement and temperature and other mechanical forces. It makes sense that massage would talk to the mechanoreceptors. So as you read down the rest of these, think about how massage application, the push and pull of it, can talk to each of these sensory receptors. And then we have our sense of where we are in our environment in space. And that has to do with my awareness of where my arm is. We can get some distortion in this. Sometimes there is a dysfunction in this area and we might feel like we're floating or something. And then we get it also involved here is stuff that is relaying information that's kind of in the muscles, bones, joints, connective tissue. Those are our proprioceptors. And then there's also the inner ear or vestibular system that very much interfaces with that. And then this gives you an overview of how these reflexes actually work, from what is the stimulus and where does that go and how is it interpreted. And so we've got, especially in the somatic part of this, we have the stretch reflex and the tendon reflex and the flexor reflex and the cross extensor reflex. And this is also why anything that goes through the body, sensory data and response, motor, is a whole body response as opposed to isolated, especially when we get into these flexor reflexes and crossed extensor reflexes. So if I burn my hand and I pull away, because that affects how I am oriented in space, the whole part of that is the whole body is involved in that, not just, you know, the tip of my finger. So this gets into a little bit more technical information. And then we also have to realize that this connective tissue, and the wrappings called fascia, that's highly innervated, and we're starting to understand how that might be where a lot of sensation and response, motor, is processed, and how we adapt to that. And then we get into the autonomic nervous system. Again, lots of YouTube support here. Slow down, pay attention to this. This is where a lot of the benefits of massage most likely originate from. Sympathetic, that's your fight, flight, fear, excitement. Parasympathetic, rest, restore, rejuvenate. And some activities through here that try to help you get a sense of this in actual behavior. So make sure you slow down and do those. And an explanation here of how Eastern philosophies form and function kind of really can come forward in the autonomic nervous system. So another activity here, stop and read your professional applications, do the activities. And then finally, before we get to the pathology, we're getting into the other sensory mechanisms that we have. And we use them all. Touch is a big one for massage therapy, but you can't separate that out from the total experiences of our sensations. So the environment we create, the lighting, the smell of the room, all of that is going to affect the experience of massage and how we give a massage and how we ourselves respond to being a massage therapist. We incorporate these, you know, the spa environment, the wellness centers incorporate a lot of this. So towels and stuff's really fluffy and nice, and there's nice music that goes on, and the environment smells fresh and clean and relaxing, maybe even with essential oils. And so that's one of the really nice things about the wellness center spa industry, is that they deliberately incorporate all of the senses. So this part of the ear that is involved in balance and equilibrium, the vestibular system, this can be a very important part of how we sense ourselves, our kinesthetic sense, our proprioceptive sense. And distortions in this area can be really difficult. I have something called benign proximal vertigo, and it's a mechanical thing where little crystals, like little pebbles, will get into the wrong place in my ear, and they signal by moving around in that jelly-like substance in there and the little hairs that are in there. They signal that I'm moving and stuff, and I'm not. And there's kind of an undergoing a little bit of anxiety there, and some undergoing nausea, and sometimes it's a little better, sometimes it's a little worse. I think sometimes I tolerate it better and sometimes I don't. And there's some treatment, there's some positioning and stuff that they can do with that. This could be an underlying reason why somebody is experiencing some symptomology, muscle tension, or even some anxiety. Maybe it would be a need for a referral to see if they can get a diagnosis on that, if it is part of what's going on with them. And then we have our vision and how we visually orient ourselves. And the eyes have a tremendous amount of nervous system sensory and motor input. And they are in the picture. Like if you've hit your head, your eyes have moved. And so there are actually some massage applications where you can use the eye movement to trigger a motor response that would help the muscle be a little less excitable. So kind of interesting there. And then our taste as well. And smell. Smells really primitive sense. It's pretty cool. The whole mechanism of breathing and bringing in chemicals that then trigger responses to sense. It's the aromatherapy type concepts are working through that. But our mood can be smelled through some pheromones, and you might want to look that up a little bit more and see how human beings are affected by pheromones. And then our pathological conditions, medications, and then our somatic compression syndromes, which I talked about earlier. These, you need to know these are likely going to show up on the Emblex exam. Some actual infection. There are viral infections that like to live in the nervous system, and they come out and cause a problem, and then they go hide for a while. So there's vaccinations to a certain extent, like for polio, but others not so much. Viral infections are difficult. And then we have the autoimmune type conditions where who knows why the body tends to turn on itself with those, with too active of an inflammatory response. And our neurotransmitter-based disorders, this chemical soup that we talked about earlier. Now, neuropathy is very difficult to manage, and it's common with diabetes, and it's a persistent, hot, cold, tingly sensation that usually is in the periphery, but can be anywhere, and very, very difficult to treat. This trigeminal neuralgia goes up into the face, very painful. So do make sure you screen and ask about any neuropathy. If somebody has it, they'll know it. And massage can and maybe be helpful, but be particularly careful of the trigeminal neuralgia. You can trigger it. Headache we've talked about. Vertigo I talked to you a little bit about. And then we have our whole enteric, our whole gut pathology. Oh my goodness. What a lot of research and information is coming out about that, and the whole bionome and the interface between gut bacteria, and they actually produce neurotransmitters and hormones, and go outside of this textbook and learn more about this. It's very fascinating. Here is our scenario. You know what to do with that. And it's likely that we're going to discuss some of these when we have our Zoom meetings. And I will have had an expectation that you can speak intelligently about this because you've puzzled through it. And our questions. Okay. Very important. A good solid knowledge of the nervous system and the autonomic nervous system is an underlying theme on how we develop indications and contraindications for massage. So have that part of your brain that is constantly questioning, how would massage interface here? How would massage interface here? And the information that's coming forward with this is just fascinating.